As widely reported, here in the United States and abroad, Actos, a popular drug to treat type 2 diabetes, has been linked through clinical studies to an increased risk of developing bladder cancer. This drug, sold under the brands Actos, Actoplus Met, Actoplus Met XR, and Duotact by Takeda Pharmaceuticals, contains Pioglitazone, a prescription drug of the class TZD, or thiazolidine-dione, which demonstrates hypoglycemic, or low blood sugar, anti-hyperglycemic high blood sugar, and anti-diabetic action. Now Actos has been linked to bladder cancer. In Europe, both France and Germany have withdrawn Pioglitazone products from the market because of safety concerns. This action was based on a clinical study conducted by the French National Health Insurance Plan, using 1.5 million diabetic patients treated with Pioglitazone. The results of this study showed that Pioglitazone treatment for over 12 months carried a 40% increased risk of bladder cancer. However, the study stated the risk of shorter-term treatment, less than 12 months, causing bladder cancer cannot yet be excluded. Another study in the U.S., performed by Takeda Pharmaceuticals, the drug's manufacturer, following 193,099 patients at Kaiser Permanente over 10 years, found that with Actos, there was an increased risk for bladder cancer, a 60% increase after 24 months of use and 80% after 48 months. Inside the human body, the urinary system involves the kidneys and bladder. Urine forms in the kidneys and flows to the bladder, which is a hollow, balloon-shaped muscular organ. Urine collects in the bladder until it is expressed through the urethra to outside the body during urination. One of the factors associated with bladder cancer is that urine can be held in the bladder for hours at a time, and its contents, when harmful, can chemically interact with bladder tissue. Looking at the bladder's structure, its wall is layered. The urothelium is a thin layer lining the inside. Then there is the lamina propria, which is loose connective tissue, then the bladder muscle, and finally a layer of fat. Bladder cancer occurs when healthy cells begin to grow at an unusually fast rate. This happens because the cells have developed the ability to divide sooner than they're supposed to. This increased tissue growth produces masses, or tumors, that, when malignant, continue to grow uncontrolled. There are 4 types of bladder tumors. First, there is small cell carcinoma, which is an extremely rare form of bladder cancer that can occur in any part of the bladder. Then there is transitional cell carcinoma, or TCC, which appears in the innermost tissue layer that lines the bladder. Another is squamous cell carcinoma, that originates in the lining of the bladder, but grows differently. And there is adenocarcinoma, which forms in the glandular or secretory cells. Generally, there are 2 diagnoses for transitional cell carcinoma: superficial, which is confined to the lining of the bladder, and invasive, where the tumor has grown, penetrates the layers of the bladder, and invades other organs and lymph nodes. The most common warning sign of bladder cancer is hematuria, or blood in the urine, which may or may not be visible. Other symptoms may include change in bladder habits, including having to urinate more often, an urgent need to urinate, or burning when you urinate, needing to urinate but not being able to, difficulty initiating or stopping urine flow, abdominal pain, loss of weight or appetite, and persistent lower back, upper thigh, or pelvic pain. If you are experiencing these symptoms, please contact your doctor for an evaluation of your risk of bladder cancer. Testing includes a CT scan, urinalysis, internal exam, and IVP, intravenous pyelogram, a cystoscopy, biopsy, or urine cytology. A prognosis is based on the stage of the cancer, the type of cancer, and the patient's age and general health. Do you feel you might have an Actos claim? Our firm offers a free evaluation.